industry colleagues. Welcome to another new episode of the Quest for Excellence series, Season 1, brought to you by Intellectus Consulting. The Quest for Excellence series has now completed 3 months, featuring 16 rich episodes and interviews with leading industry business leaders of our Indian pharmaceutical industry. This series has received a very warm and enthusiastic response from pharma marketeers, business unit heads, business directors, vice presidents and cluster heads, as well as chief executives and managing directors of pharmaceutical companies. We are extremely gratified and feel humbled by the warm and enthusiastic response that our series has received so far. It has been our honest endeavor to raise the standards of marketing excellence in our industry, promote the highest standards of brand building excellence in our industry. And towards this endeavor, we have featured interviews with some of the most respected, well-known, and extraordinarily competent business leaders of our industry who've had a fantastic track record of building brands and businesses for the organizations that they have worked with. It is my pleasure today to bring to you another new episode of the Quest for Excellence series. Today is an episode that I have been personally looking forward to with a great deal of excitement and enthusiasm. And what could be the reason? The reason is the episode features our interaction with one of the most respected marketing gurus, or what we call as marketing legends of our pharma industry. He has spent over 3.5 decades in the industry across functions of sales, product management, marketing, strategic marketing, and general management and business operations. In his professional journey of 3.5 decades, he has built some of the most iconic, well-recognized brands in the pharmaceutical industry. He brings with him a rich experience of having worked with not only world-class global innovator multinational organizations, but also Indian organizations where his experience has been enriched all the more. Friends, it is my honor and privilege to tell you that our guest for today is Mr. S Vasan, who is the Senior Vice President for Sun Pharma. Mr. Vasan is an industry veteran with over 3.5 decades. Many of you who would have heard or known Mr. Vasan would identify him as the gentleman who gave this industry 2 of the most iconic brands when he was associated with the respective organizations. He's known as the Augmentin Man because he launched Augmentin way back in the early 90s when he was a brand manager with the erstwhile SmithKline Beecham Pharmaceuticals prior to the merger with Glaxo Wellcome. Subsequently, when he joined Sun Pharma in the early part of 2000s, he launched Ultracet, which became the #1 prescribed and selling brand of opioid analgesics in the industry. It's very nice to see you after many years, and thanks so much for having accepted our invite, because I was really looking forward to you being a part of our series, because the kind of great knowledge and experience I had, especially in brand building and marketing, is something that I wanted, to share with our community of pharma marketers. So, yeah.
No, it's my pleasure, Shaileji. In fact, I should tell you that, we know each other for a long time. and I have tremendous respect and regards for you. You have been one of the champions in the industry. I know you, the stuff what you have done for diabetes care, and also later on, I think you had a stint, you did a lot of job with respect to the MABs. I think
Yes,
insulin
Remicade,
MABs
which is
and
a
all
Janssen
that.
brand. Yes.
Very, interesting set of products, but then maybe challenging to launch at that time because perhaps the country was not ready, the patients were not ready, but then still made a great inroads. So that way, it's my pleasure to be in
Thank
this
you so much.
program.
Thank you so much, sir. So my first question to you is, as an opener, is you've spent a phenomenal 3.5 decades in the industry, right? Across the domains of sales, product management, marketing, business operations, and now, as the SVP Cluster Head for 10 businesses of Sun Pharma. So my first question is, do you get time to pause, reflect, and say, oh my God, how have these 3.5 decades passed by just like that? So I just thought of asking you, or you just feel, no, let's go on. How has it been for you, sir?
No, I think good, Salajit, thanks for your kind words, but I should tell you that, it has gone off like a breeze. I just can't realize. Sometimes I look back and it looked like that only yesterday I was there in Madras city carrying my bag and working as a medical rep. So, time has just flown by. There's no doubt about it. And yeah, I mean, life is complex. So, I always get inspired by people who do even much more complex things. And, one needs to stay humble. It's not one's effort alone which takes someone to some position or the designation what you get or whatever. There's a lot of other stuff which go along with that, the right opportunity at the right time and being in the right place at the right time, as they say. So yes, I think it has been pretty quick, 3.5 decades. I can't believe, but the industry has also changed, evolved quite a lot in this time. I think if I look back and I see when we talk about experience, it's not that what I did in the 90s or even early 2000 that is keeping me in my job now. Uh, Actually, many of them may become maybe absolutely irrelevant in today's context. But what is important is to actually sense the change in trend that there is an inflection point, there is something that is happening, and you adapt yourself, you get ready ahead of everybody else. Once you get that sort of an insight and you see that change earlier than others, then I think things keep happening and you survive or maybe thrive in the industry. So that's the way I see it.
Right. Sir, when you reflect on these 3 decades, it's obvious that a lot has changed, as you mentioned, in terms of not just the sales function, but the marketing and the brand building function. So, any specific thoughts on how the industry has evolved in these 3 decades around the brand planning and brand building piece? Because you have been a very, very intimate and a close and a passionate marketer for marketing. Have you seen this evolution happen? And if you could share your thoughts over the last 3 decades, how has it evolved?
Yeah, very nice. Uh, People say things have changed. It is cliche to say that things have changed, and I think things do change sometimes a bit slowly, but sometimes very rapidly. So that has been the part of history. You take industrial revolution was a point where things started happening pretty quickly, and then countries had to adapt themselves. And something recent is about this pandemic, which we are all going through, or which we have almost successfully transitioned by and large. So these are serious inflection points, and then we find the life is not the same as it was before. So if I have to track the pharma industry, I think we have come a long way. There are a lot of things to be pretty proud about the way the industry has shaped up. And in terms of even sheer statistical numbers, I think there's about $50 billion industry. It is maybe partly the domestic market and partly the exports. So the domestic market has grown, the exports have grown, and we have always been, in the forefront of manufacturing. We have got more USFDA approved plants than any other country in the world other than the US. So, industry has grown phenomenally in terms of size, and uh, we are a formidable force that way, Indian pharma. Now, when I see particularly the selling aspect, the marketing aspect, the formulations, when we were out there in the field in 1980s, we used to say, this is the first time in India we are launching a particular product, maybe an antibiotic, antihistamine, whatever. But you would find that this product actually in the US, it has been launched even 10 years, 15 years back. And we will still say that is the first time in India. So, so it was a huge gap. And then when we went into the 90s, this sort of gap started shrinking. So earlier, it was like today, if I see, if you have a cycle, companies used to have a cycle of, say, 2 months or sometimes even 3 months. And a few companies maybe had at that time a monthly cycle. So that means a cycle when I mean that you're supposed to visit all your customers. The rep is supposed to visit all his customers in the list within that particular period. So you launch a product, say, 1st of April, some of the customers in the list may actually come to know about the product only 60 days after you have launched it, technically. And, they were patient, they were waiting, and some of them, they gave a lot of time to us to listen to the product and, talk about it, leave samples. And then you meet him after another 30, 45 days, or maybe even sometimes 60 days, and you will ask for a feedback. He will remember. He will say, oh, yeah, I remember last time you had given me. I've tried in a few patients, or he will give you a feedback. So that was the pace in the 80s. So then we went to 90s, this gap shrunk, and then we saw a lot of molecules being launched with, the foreign speaker symposia, what you typically call international speaker programs, what they call ISPs now. So you have a key opinion leader who have done trials with the product. He would come into the country, go to various places, and then talk about his experience. And then the Indian doctors would listen with rapt attention, and then they'll start prescribing. It was still slow. And then when you come into the, I think the noughties, the 2000 and later, I think internet changed a lot of things, needless to say. The internet penetration went up, and that was the time around 2003, 2004, etc. You find that actually the message was reaching faster than the messenger. If you take the company appointed sales guys as the message had already reached the doctor, because he knew that what you're talking about, what product has come out in the market, and the perceptions about the brand was formed even before, you met him. So it's no longer an introduction, but you have to manage his perception, whether it may be good in some places because he says, I know this product, it works faster. Or at times he may say that, no, I know this product, but it's a damn good product, but it has got hepatotoxicity, something of that kind. So then, it's a different ballgame. So you need to either strengthen the perception if it is the right one, or if you find that it is slightly misaligned, you need to actually get him aligned to what the real evidence is and what it says and all that. So it became a different ballgame altogether. But then when you got, in the last 10 years, you see plethora of companies, plethora of brands, you've got the companies even like Headros, MSN, Shilpa, BDR, Brinton, all these companies can trouble the big multinationals or even the, leading Indian companies. So you have to be far more agile. All of them have come in. There is multi-branding strategy. You want to dominate a therapy, then you want to, you look at the patent scenario, and then you want to have a patent busting strategy. So it has become far more complex today in terms of the brands that are being launched and the complexity it creates, multiple brands. And, it looks like a madhouse, but then I still believe that there is a lot of meaning to this madness. And if one can up their game and play smartly, it can throw up winners. So that's
Right.
the way I see the progress.
Thank you, sir. I mean, that's an interesting comment because you actually kind of preempted my next question, because complexity can either bring in chaos or it can bring in a lot of fast-paced changes where people, tune themselves to meet those changes and challenges. So, in your assessment, has anything evolved for the better, especially in brand marketing, brand planning, or is anything not evolved as per the expectations? Is there something that you have noted, sir, in all these years?
So I would say what has evolved for the better. See, those days, we used to have a brand plan or a marketing plan, which was done a couple of months before the beginning of the year. If you're a multinational, then typically Jan, December was your year. So you get busy by around, say, July, August, and from your headquarters, you get everything finalized by around September, October, and you're ready. And then you go and execute it. So similarly, if you are working in an Indian company, then maybe April, March was the year. So you get busy and you wrap up everything by around, say, February or March latest. And then that used to be the operating manual. So this is what I want to do. And it used to be a large sort of 100-page docket or something. But then things have become, like today, if you see, yeah, there is still an operating code, but we don't make such a big, large, dockets any longer because, we know what we want to do and we know why we want to do what we want to do. We know where to resource, how much to resource, and we also keep it flexible, a little bit. We need to be agile because things change, pretty rapidly. As I told you, in those days, like you have a brand or a plan. So about a product or about whatever, the therapy, new treatment options in say 30 years back or something, or even 20 years back, the perceptions didn't change wildly within say 1 year or 1.5 years. Whereas now, a trial which comes out to say that, it is very good in terms of increasing survival rate, say, for an oncology product, or it causes some, cardiac toxicity, whatever it is, then things change very quickly. Then you have to have your next batsman padded up. How are you going to manage the situation? And you need to change your batting order, reserve something else. So we still have an operating manual, but our eyes and ears are far more open. We are alert and we keep, so we are able to sense the doctor's thinking and get insights far more, quickly, and then alter ourselves accordingly. And where things are pretty flat and there is no much change, then we continue with the plan. So that's a big change. It's just maybe a set of 20 slides, make a marketing plan today, and you know what the key issues are. So you don't go and start from what is the structure and all the history of it.
Sir, there is a question which I was always wanting to ask you, because this is something people have different perspectives, and so coming from a industry veteran like you would probably add a very rich, dimension to this question. When you started your career in way back in '85, you were a medical rep, PSR in Fulford and Chennai, and then you got into brand management. I'm sure that the learnings of the sales function, call planning, making calls, convincing customers have stood instead for you for the next 30 years of your life in marketing. My question is two parts. One is, if you can reflect and say, what were those learnings you took into the job of marketing from that sales? And second thing, sir, today, for the last 10 years or so, product managers, when they come in freshly minted MBAs from B schools or from the sales function or whatever, they don't have that much, I would say, liking or feel for sales management, and they see that the sales piece of experience is not necessary. And I find that even when with the young crop, what's your message? Don't you think this is important, or do you feel no, the changing times are like this, so we live with this? What is your take on, or what's your position, sir? I just want to know, sir.
Actually, Sailesh, it's a very interesting question and maybe a sensitive one also, but I'll give my frank opinion on this. Very sensitive. You're absolutely right. it is not any longer that, guys see that, okay, I've come into marketing, I've done my MBA, but then, do I need to do a sales stint, I think that's not the right thinking. It's not because I have a sales background initially when I started out. It's not so, because you take big companies, you take the Unilevers of this world, or even those days when Glaxo was dominating the Indian pharma industry for the 3 decades. Guys used to have a sales stint necessarily. And, particularly you are thrown into some difficult markets like Uttar Pradesh, Bihar, or wherever it is. And then you understand the mechanics of how business is done at the ground level. So that is how it has been always, with the big companies which have made it to the top. I think whether it is consumer or pharma, I think this has been pretty much the sort of a norm that you need to have a sales responsibility and maybe, a sales marketing responsibility. Then it is very good. Then you reach the top and you reach to become a CEO. So this was very, very crucial. Now, that is a fact. Now, why this is very important is what I want to actually emphasize. It is important for the company and it is also important for the individual, because largely, particularly pharma industry, if you take, it is largely actually a people-oriented industry or a people-based industry. That's what we all say. Why we say it's a people-oriented industry? Because we employ large number of people. So companies today, if you see, they employ people in thousands, in the field, and every day there are decisions being taken. Your frontline manager takes a decision, your second line manager, your third line, your NSM, everybody keeps taking. It's not like it's on an autopilot mode all the time. You need to intervene, you need to take calls, take decisions to move on. How do I win that customer? How do I get more prescriptions? So what happens today is that if you don't have that experience and you come out of B school, which is very good because you have got structured learning, you understand the various nuances and all that. But then, we tend to think at times what I design here, what I develop here is what my communication is what actually is making a big difference to the brand. And that is what is giving me increased share. Yeah, it can. But the communication or what is developed at the head office here by the marketing team with no sort of not to, demean that, it is very important. But beyond that, there are a lot of other things. As the saying goes, the worst of strategies, if implemented, can get still some results. But the best of strategies without any implementation gives you no result. So what happens? I see this. What is happening is something like a laboratory type of a thing where you say that this is what I'm going to create and this is what I'm going to do for my product. But when it is thrown in the actual real world out there, there are so many other factors which come in. So some of them are, how much time you get with your doctor, how smartly the competitors are trying to knock time. And, today you've got the card system to meet a doctor. You need to drop your card much early. Doctors' constraints. And in meeting reps, we talk about RCPA. And, quite literally, you tell me to do a very good RCPA, you need to spend at least 15-20 minutes with the chemist before every call. So you need, those constraints are there. And, the distribution constraints are there. So many things are there. So if you don't get a first-hand experience or understanding of all these things and you design a strategy may be great, but is it fitting into the context in the limited time that is given and with all these other complexities that go along with that? You may lose out on that. So that's why then you get fully rounded up view of both.
Right. Sir, I would like to continue on this thread for just a minute or more, too, because you have raised some fantastic points, and thank you for actually sticking your neck out and saying that yes, sales experience is important because pharma marketing and selling is not the same as an FMCG or the standardized selling. It is more because the customer is evolved, he's sophisticated. We need to message him, as you rightly said. What is your take, sir? Do you think that the person should immerse himself totally in the sales function, or he does this, regional adoption or geographies or markets that they adopt? Companies ask brand managers to adopt regions, go for 4 days, 5 days a month. Is that helpful, or do you feel he should go and immerse himself at least for 1 year, learn the nuances? What's your take, sir? Just
I think Silent, you have this knack of hitting the controversial points, but I would still give my take, very frankly.
Absolutely, it's your independent opinion, sir. Yeah.
See, I can always say something is better than nothing. But if you seriously ask me, getting an MBA out and then saying that for 6 months you do a field stint, for 1 year you do a field stint, and then you will be absorbed at HO, I think that's not the right way to go about it. Because it's okay. As I told you again, something is better than nothing, and we have to see that if the whole lot feels like, why do I go and slug it out in the market, and does it really help me? Then we have limited options. We have to think very creatively of how this can be got done, because if people come with a mindset, or maybe we need to tell them that, they can be treated well, treated better, maybe because of their background, education and all that. Maybe they can be put in better hotels and better in terms of travel, etc. But then that really doesn't serve the purpose, because they feel like, look, I'm here to actually, my destination is head office, and I'm here to just serve a time period. But then, this target breathing on your neck month on month, and achievement of those target, those numbers month on month, and then coming out a winner, that has a different feeling altogether, that unless you go through that with the responsibility, you don't get into the thick of the action, number one. Now, giving a brand manager some region to manage, and it's okay, it's good. But your neck is not on the block. Like typically, sales is like playing fast bowling, if I have to use a cricketing analogy. So it's good. You learn something, you understand, but primarily it is your regional manager or your zonal manager who is running the show there. So you can support him, you can go and work in the field. But then how do you manage a team? There are so many complexities. Phones go off and the sales numbers have to come. You have to call up HO and give your final figures, and somewhere, invoicing is stuck, and somewhere somebody is missing. Your team member, or somewhere somebody has delivered more and he's asking like, look, I have got so much more to invoice. You tell me, where do I stand? Do you need my help, etc., etc.? These are a whole lot of things, which actually you manage. Like it's like you call the sales army. You can't. If you want to have an army experience, you need to go to the battlefield and fight. So even for a duration of say a couple of years, you do this job actually, and do it well. Then I think you gain far more than the sort of touching the just the peripheries and doing the role. I don't know. That's my view. Huh?
Absolutely, sir. No, I know you've been a very straight and a candid person. That's why I wanted to ask your thoughts around this. And thank you so much for actually putting out your view, which is a clear message to our marketeers and our audience that there is no substitute for sales experience, as you rightly said. Second, you always believe that a full immersion sales stint is obviously far more enriching and wisening as compared to just doing a part-time sales job with probably lesser accountability towards the whole results, and that could be the reason, sir. I completely agree with you. Thanks for that, sir. I move to the second part of our conversation where when you got into marketing and you had a great ride, starting around 2003 in the erstwhile SmithKline Beecham, which was considered to be one of the most powerful marketing organizations at that time, because I remember I had started my career then in 1994, freshly minted out from the B school, and Beecham was one of the most respected and go-to organizations for marketing. And in that organization, sir, you built some of the most fantastic brands, which are still iconic brands for the industry even today, something like Augmentin, which I think has been a classic marketing case study for all of us in the industry. So being so closely associated, sir, and this entire series being on marketing excellence, I would request you to share your thoughts, your learnings around the Augmentin, pre-launch, post-launch learnings and experience that you had in building this brand, sir. And what would be the learnings that you would like to pass to the marketers of today's generation, looking at those such beautiful launches that you've had a couple of decades ago? So that's my request to you.
Very nice elegy of you once again. Just if you permit me, I just wanted to complete my answer for my previous question. Just a couple of lines.
Sir.
What I wanted to say was the same way, a sales guy who is also aspiring to be a BU head can also do a marketing stint. It is not like, today you can take online courses, you can take part-time courses or whatever, and come to head office and do a job of managing a brand. So then you get a wider perspective. So it works both ways. I just wanted to complete my answer by saying, because at HO when you work, you have got the big picture. You know what the senior management is looking at, their vision, how they want to take it forward, this therapy area, this brand, etc. And also you've got access to a lot of data. You've got typically called the IMS data, the SMSRC data, whatever. You've got prescription audit. You've got so many other market research agencies working with you. So not maybe the bright sales guys who have got a penchant for marketing can be given the stint and put in HO as well. So it works both ways, and then you get fully rounded off, sales marketing personnel or a BU head. Otherwise, this divide keeps happening, and it's not good, it's not good for the industry. Now, coming back to what you asked about my stint in SmithKline, Beecham, and then GSK. Yeah, long ago, but I would tell you certain things don't change. Certain things don't change with the time, and those principles are still valid. First is, when you take and launch an antibiotic of that kind, what you mentioned, first thing is to estimate the market opportunity. So I think we have to estimate it correctly, and that goes to when how do you define a market? See, I'm very disturbed when people say that my market size is so much, these many crores, or I think that's not the way to define. Then they say I have a direct market, I have an indirect market. I think market, when you define, it's a set of patients who are having a similar set of problems or suffering, for which your drug can actually offer a solution. Maybe a drug can offer solution better than whatever else is there in the market today. So once you define the market like that, then you are taking your eyes away from what is the size of the market. That comes later. So then you classify all these people together, like people who are suffering from respiratory tract infections, people who are suffering from otitis media, children who are suffering from otitis media. Then you say that there are so many cases of bronchitis, bronchiectasis, acute exacerbation of chronic bronchitis, or pharyngitis, laryngitis, otitis, whatever it is. Then you say that, okay, this could be the size and what are the products used there. And you find that these are the products used there. And then you say that in what way your product is superior to something else that is offered in the market today. And also understand the limitations of your brand versus the others. Don't try to push hard, try and sell and say that, look, this is just the next best thing to, since sliced bread, if I can put it that way. So don't try to overdo. So once you understand this, then you see that, what is the value it is offering, for which what price can be reasonably commanded. And so if I put everything together, I think it starts from there. So who are the sufferers? What do they need? Which your product can offer in terms of a solution, what they're looking for, and in what way it is better than the existing stuff, and at what price you can have it. Once you get this right, because this would determine what amount of resources you are going to plow in behind the brand. So like, for example, you take an antibiotic, you can always say that those days, they used to say that this is a premium antibiotic, or this is an antibiotic which is just in the quinolone category and competes with other quinolones. Then it then came into within the quinolone, we compete within ciprofloxacin or norfloxacin, or within similarly cephalosporins, whatever, I'm competing within the second generation cephalosporin. I think those don't do justice to the brand, what we are talking. So what we need to do is, yes, this is for respiratory tract infection. This has got these advantages. It is a resistance fighter. It has got potassium clavulanate, and I'm going to focus my communication on clavulanate potassium. So first is you estimate your market correctly. You resource it accordingly because you have estimated it well. And then now you get why to use this, because it is a resistance fighter. Then you decide what is the awareness of resistance in the doctors group whom you are reaching out to, and what all you need to do, what are the dots you need to connect before you make a case, what evidence you can bring to their table to say that this problem is much more than what you think, and then how it offers a solution. So then by that time you're slowly getting into strategizing, communication, and all this is fine. And then finally your field force, your execution, their energy, enthusiasm, I think all these things went right for the brand, what you're talking, from market estimation. So we never said that. We always thought that this should be the biggest antibiotic in the country from day one when, the brand was launched by the erstwhile SmithKline BGM. It said that this should be the biggest brand because that is what it was in most parts of the world. And you say that this is a logical successor to amoxicillin. But in India, we had another handicap, though it was a logical successor to amoxicillin, but the price was 10 times more than amoxicillin. And we had already the latest macrolides and the latest second and even third generation cephalosporins in the market already. So it was a slightly tricky scenario because we were a little late when we came in 94 with the product. But then you sort all these things out, and then you get your story right, and then you go, and in terms of planning, I think you need to have a broader view. You can't plan for a quarter, or, you need to have at least a broad plan for 2 years, but always, being agile to keep it flexible and then do those iterations wherever required. So that is the way we went about. And then, you have some story to the field. Every time doctor then after some time starts asking what is new. So you should have something new, you should have something new, or at least even if there is nothing earth-shaking that is coming out, you then at least try to wrap up in a new gift wrapper and say that, something of interest, at least the rep gets interested, or you can have a new type of a demonstration within the doctor's clinic. So these things, I think we got it right. And then getting all the, support functions, etc. to, the product manager, actually, if you ask me, Saleji, he's a key guy. He should show enthusiasm, drive. He can't throw in the towel at any time. He should be seen as a guy who is actually, running around to get this product, whether it is about getting the stocks on time or, procurement, manufacturing, distribution, and then, of course, marketing. Is the managing director of the product, so to say. Then, of course, big brands are built.
Right. Sir, continuing on the Augmentin story, I remember in the initial launch phase, and please correct me if I am wrong, you also had a very great outlook that you will not spread yourself too thin across, because generally what happens, sir, brand managers, they might tend to get greedy. Let's try and grab share from all the indications, all the doctor specialties, surgeons, ENT specialists, gynecologists. But I think you were very focused as a brand and said, we will just go down on 20, 25 doctors in a red territory. We'll focus only on the top 2 lead-in run-in indications and build the brand, consolidate it well, and then expand it. That, I think, was also a reason for your brand success, sir.
No, absolutely. Saleshi, good you brought this out. Yes. So we didn't want to spread it thin in terms of indications. It was very good with skin and soft tissue infection. It was very good in urinary tract infections, but always in urinary tract infections, you had got quinolones already there in the market, and fluoxacillin was doing a very good job as far as, fluoxacillin combinations were doing a very good job as far as most of the skin and soft tissue infections were concerned. So we said, no, we'll stick only to respiratory. Similarly, in the field, we said that we want the chest specialists, ENTs, with the support from microbiologists, and maybe the intensivists for the IV version of the product. pediatricians. We want only these select doctors. Maybe initially we started with 25, maybe we made it 35. So we wanted to have a set of hardcore committed prescribers before we expanded. Now, the thing is, people will ask, how relevant is that today? Because today brands are being launched by so many companies at the same time. If you are exclusive in the market, Augmentin that way was lucky because we had about almost 18 months of exclusivity since the time SmithKline Beecham launched it before somebody else hit the market. But today you don't have that luxury. I am not the only guy who is actually controlling the market. There are so many. I don't go to some specialty of doctors, but somebody else may go and then sell there, and then it will be too late for me to go there and expand. So it's not easily you can't replicate it in today's context. I understand that, but however, certain things don't change as I told you. First is I think today what is important is you need to be the first in the market. Now that is means you need to understand and identify this opportunity much quicker. That there is again that see the ball will come back to the court of marketing, whichever way. You are supposed to be very close to your customers. You should know what are the problems he is struggling with, the pain points, and then you know there's an opportunity for this sort of a product. You go back and tell your business development team that I think there's a gap in their practice as far as this condition is concerned. So then you start developing the product. So you should be the first to hit the market. So there again, it is actually the flow, the reverse flow. From marketing they get insights back. It goes all the way to the R&D to develop and come back on time with the product. Now then you price the product sensibly. So you price the product sensibly. So you know ultimately how much our great a product is. Unless people can afford, there is no point. So then what you need to do is we need to stay on the scientific quotient. We should be the lead company, the lead brand in terms of the scientific quotient. On all that I am going to share about this product in terms of data, evidence, not only now at the time of launch, but as I go through further 3 months, 6 months from now, how am I going to expand the set of indications? What new trials I'm going to initiate now? That's okay. You can do, every trial can't be a double-blind, randomized clinical trial, controlled studies, which gets reviewed in a high-impact peer-reviewed journal. Can't be so. But there is something called real-world evidence. So you need to have a plan entirely and stay on top so that when a doctor reaches out, he thinks, oh, I need to know something about this brand, what you have launched today. It should be your company, your brand, that should come to his mind first, and your team, which he would call to understand. As long as one does that consistently and be alert, then I think you create brand leaders. And if you have got already some sort of a hold in that therapy, it becomes all the more easy because you are already there, and the chances are he will come back to you, and you know the customer, you are already familiar. So what I would like to say is, yes, it's not the same thing as it was in those days unless you have exclusivity today. But at the same time, being there first to launching at a competitive price, enthusing your field force to take it forward, creative inputs, creative communication, meaningful communication to the customer would make the customer come back to you and ask more. So once you have achieved that, you needn't bother. Then you're not actually talking about direct competition. You are talking about only indirect competition because you want to expand the market as a leader. You are looking at how I can grab share from another molecule which is holding a larger share. So that is how I'll put it for today's context.
Oh, that's really very nice of you, sir. I think you have kind of outlined kind of a template for the understanding of marketers as to what goes into a successful brand launch, right? And what I really liked about your very forthright comment is the market size estimation. Because everybody wants to play safe and secure that I will define my market by the AVAX data or the IQVIA data of penicillin's market. But no, it is in terms of the patient sufferers of the disease, because that is what it is. As a category, any antibiotic can be used, sir. I think that's a very good message, because this is what we try, and when we coach our clients, brand managers, this is the basic problem in understanding, because they're so focused on that particular category, that defined market, the represented RPM. Their whole life goes around RPM rather than seeing it from the patient burden or the disease burden. I think thank you so much for saying that. It's important, but you've got to think strategically as a marketer as to what are the disease pool or the patients available, sir. It's very nice of you to have put it. Apart from, of course, those old tenets, which I agree with you, he has to drive it with a lot of fire, passion, do the right kind of positioning, go to the right set of customers, etc., and work with you. Thank you so much, sir. So I come to the third part of our conversation, which is devoted to strategic marketing excellence. And this is something of a subject I know is close to your heart. So I want to ask you a couple of questions and invite your views around it. First question, straight off the bat, because you love cricket, is: are you happy with the standards of marketing in the industry today? I mean, the kind of marketers who handle brands, is it strategically managed? Is there a marketing excellence ethos? And do people really think long term in terms of brand building? That's my first question to you, sir, because you have seen the evolution and you've been committed to the old school, but you also realize that there is a new way of marketing. But what's your general take on this? Is there a commitment to the process of marketing excellence? And my second question, sir, is I don't know how you see it. When I've worked inside the industry, now I look at it outside in. Brand managers of the current generation, whether he has 5 years or 7 years or even 10 years, I'm quite surprised to find that when it comes to critical aspects of thinking on the brand, like, life cycle management, pre-marketing, pricing strategy, doing insights mining, they're found wanting, sir. They don't think deeply enough, is my view, but I don't want to thrust it on you. What's your take on this, sir? Is it a cause of concern? And what is your view? Does it require addressal, sir? I just thought of asking you this.
I know. Again, it's a very sensitive question, but Shaileji, you have been doing a great job for the young marketeers out there. So, that's our interest. It's not to be critical of anything that happened before or that is happening now, because good things happen all the time. So what I would say is, I would say in certain aspects, I think currently there are certain things which people are lacking, which they fail to see, which were seen by the previous generation of marketeers. But in certain aspects, today we are far better as well. So we have actually adapted to the new environment. As I told you, today it is a far more complex game. It is moving from test matches to T20 cricket, So, it's a far more complex game, multitude of companies, a lot more serious competition, and your pecking order can get, changed pretty soon. So, I would say what has actually got better over a period of time. I think today, in terms of innovation, we are very good when it comes to R&D, innovative, I say incremental innovation, products with some sort of differential somewhere, which we, in technology, which we, particularly Indian companies have done that very well, to go and talk to the doctor and say that, look, this is an advantage, and, that's something which is good. And you don't dump the product just because, it is past its life cycle. We all know that, this product life cycle is also is in somebody's mind. Brands don't die, brands live on. It's because human mind is discerning. It will come in some form or the other. You can reinvent. So even in a generic market, when you say a generic market, the company becomes a brand. You still choose. You can choose some company versus the other. They market a lot of products together. For a minute, if you go away from pharma, you still have a set of products under Google, but only Google. And you have a set of products under Apple, but it's an Apple product, So the company actually becomes much bigger than the individual branded product. So somewhere branding will always have its role. Now again, coming back. So today, if you see, companies have adapted in terms of customer centricity also has improved. People know a lot about the customer in terms of actual details, the multiple places he practices, what is the likes. dislikes, how do I reach him, and how do I service the customer, and almost every customer is tracked in terms of very closely in terms of how often I reach. Salesforce effectiveness has improved. The matrices to measure that has improved. How do I, what returns I am getting from a customer, and do I actually shuffle my list, and all this stuff we have improved. But having said that, where I think where we are sorely missing is, to still get deep insights about the therapy, and to get, you need to really, sometimes I feel very sad. I go to a conference and I find most of the brand managers and the marketing today team today is standing outside, in the reception area in the stall. But I think somebody should be there inside the stall, apart from the medical people from the company. The marketing guys should be inside the hall, and they should be attending sessions to understand the real challenges what the doctors are facing in their practice. And you get a lot of insights. And those days there were not so many happening. Today you can organize one at in the western suburbs. You can have a sort of a small DGM in Mumbai. You can have one for central suburbs. You can have webinars. You can reach out and get a group of doctors to discuss on a subject for just say 1 hour. It's not like you need to, thanks to the digitization, it's not like somebody has to take out 2-3 hours and leave his practice and come and then discuss. So you have so many opportunities to interact. But while the hospitality and the sort of event management, the show should go on administratively well managed. But also, what is very important is listen to the customer. It's an opportunity, huge opportunity you are getting to listen to your customer's voice on the issues they are facing when they treat their patients. What is working, what is not working. Be discerning. We think that we go and tell something about our product to the doctor and he has accepted, yes, everything, yes. No, not so. He may not tell. He or she may not tell you that this is the problem with this molecule, but then they know. So then, you draw these insights and then base your strategy based on these insights. And then you check out again after a few months whether it is working okay, or do you need to course correct and all that. I think that part we are missing. There is this huge rush to do campaigns, and sometimes, there's this campaign mania. So you take a product, and we are not selling biscuits and soft drinks that, I need to, they have, Pepsi or Coke is a colored drink. So you need to run through campaigns. We are talking about science, the highest form of science, pharmaceutical science, medical science. And so you try to understand that, you try to draw knowledge from that. And to an extent, it offers a lot of creativity as well. You can, without twisting the facts, you can still put your communication in a very creative manner, keeping the patient in mind. You can do all that. This is what it solves. But then I think more than creating noise, what is important is the core message. In what way this brand is solving your problem or your patient's problem. I think that part, I think we should get sharper. So that is where I think maybe because we are launching too many products, but then when you're launching too many products as well, a tiger is different from a cat. You should know whether you're it's a kitten or a cub. So then you feed them accordingly.
Absolutely.
So I think a lot more has to go in terms of, as you rightly said, Saileji, in terms of thinking, in terms of planning ahead. For which again it will come back to understanding not only the customer's practice, doctor's practice, but also understanding the limitations in his practice. It's not a Western world where everything is reimbursed. You've got issues in terms of how there are certain therapies like oncology. You need to patients need to move towns, come and manage, stay overnight. Who is the caretaker? Who is going to accompany? The associated costs and all the rest of it. When you get a complete understanding of all this, you will be able to definitely position your product better, market it better, and that will do you a lot of good going forward. It's not very difficult. This is far more easy, and you keep beating around by giving some rhyme and chime and all that. That's okay. I am not trying to run down creativity here. You need that creativity to get noticed. But then what is far more important is what does your brand offer? What is the value proposition you are saying? When I saying brand, I mean the molecule, what it offers. And then let us take care of how do I try to shine amongst my clones in the market. That's a different thing. But basically, what the molecule offers in terms of value proposition to the customer and the patient, I think that has to be very clear. That has to be always measured, and that has to be a continuous process. So, plan, it's a rolling plan. You keep doing it for, say, I got now for 3 months. I've got something ready for even up to, as I told you, 8 quarters. So then I keep tweaking going as I go along. That's how brands are built.
I think you've done this so beautifully and brilliantly, Vasan sir. I mean, that's why I wanted to ask you this question. I know for sure that you and I have probably stirred a hornet's nest today, but that's fine because at the end of the day, the core fundamentals of marketing, as you said rightly, sir, don't change. Everything. These are the core fundamentals: inciting, the right brand positioning that you spoke about. Tactical execution is great, but cannot be sacrificed at the cost of the fundamentals, sir. And you rightly said there is some word known as campaign mania. There is a rush to execute rather than giving thought to what is it that we will execute first. What is our story? How are we going to communicate? Brilliantly. And sir, these are basic tenets of pharmaceutical marketing. These can never change. In fact, even in 2030 and 40, it will continue to be there, sir. Long after,
Absolutely.
I think you've said a very powerful message, Vasan sir, and I'm thankful to you for that. Sir, I don't know whether you will agree with me. The leadership also has to bear accountability for doing the right things and hand-holding the brand managers so that they do the right things. Don't you agree with that also, sir? Because the managers on their own also need a little bit of hand-holding. The leadership has to also tell them and guide them. What is your take on it, sir?
No, absolutely. You're right. I think I would put 80% on the leadership, because that's the way it is. Means everybody wants to do a good job. Nobody wants to come and scope a brand. They want guidance. They want your, there's no point carrying decades of experience if you are not able to actually handhold and guide. One should understand the problem as this too much of delegation also is an issue. If you're a leader, you should know by and large what is to be done, and these are the issues, and I want to execute these things. So who is the right person to go and get this job done for me? And you recruit suitable people to get the job done. It's not like I don't know anything about this therapy, and I need somebody who has worked in this area. I want to I want to have that person on board in my team, and then he will go and discover for me, how I'm going to go and market this product. If that is the type of attitude the leadership possess, then there's a problem to begin with. So, yes. So what I would say is select the right product manager with the right sort of aptitude. Give them a longer stint. Don't shift portfolios too often. Ask them the right question. Ask them to go and see. There are a lot of passionate, young, bright, energetic people around. That is the resource we have, and they come from all types of backgrounds. You have to be, when you say you respect diversity, it is not only diversity means gender. It is also in terms of thinking, in terms of background, in terms of profile, in terms of somebody may have a experience coming from the field. Somebody may come from the top management institute. Somebody may have had a experience in market research, and they would have tried to come in. Means somebody from multinational, somebody from a Indian company, small company, big company. All of them have been successful. So how do you get those sort of? It depends on what you want to execute. Now, this is the right sort of a guy who can do this job for me, and then I give them this task. Then I stick with that person, and I try to see and say very clearly, these are the things you want to do, these are the things you want to build, and this is the way we will measure. A lot of things depends on how do you communicate. How do you communicate with your team? So if you put them always on this sort of the fear mode, that you may shuffle things off on, or there's a restructuring in the offering every couple of years. I think that doesn't do good for anybody. So you have to have somebody has to stay with the brand for long for the brand to be built, and for which you need to trust and you need to own up. If somebody, if there is a senior person who owns up, to say that, yeah, if something goes wrong, I am responsible, let us go and do it, because this is we have analyzed enough, and from the available information, this is the best way to go about. We are sure, we have done our research, we have talked to the customers. So that sort of a thing, so that senior management role is very important.
Thank you so much, sir. That is a real good message that you put out to the community, because leadership cannot shun its responsibility. They are, in fact, far more important in being held accountable for shaping the young marketeers, because they are the brand custodians and the people custodians and the organization, sir. Sir, I know we are to the hour and I respect your time. I have my last question before we sign for this. In your entire journey of 3+ decades, I'm very sure you have not seen a more iconic moment. What happened like in March last year when industry stuttered to a close? It has never happened, sir. At least I don't remember in my 27, 28 years, or maybe even before, that COVID could have such an impact on the industry, and not just in India, but globally. And because of which the industry was forced to, change its way of working, calls on customers, marketing, etc. Today, some of those changes we see over the last 18, 20 months are getting permanent in nature, sir. My question to you is, you've seen these moments and watershed moments in this industry. How do you see the future of our industry, at least in the next 2 to 3 years from now? Because one is, I'm looking at it from two aspects, sir, and if you can kindly share your thoughts. One is the digital transformation piece, sir. Now everything is moving digital, but there are some schools of thought who say phygital, which is physical face-to-face with digital. I just want to know what's your position. I know there's nothing right or wrong. And second thing, sir, I think we have always been a data-driven industry, but not as much as the Western world. Now we see that data analytics as a function, as a part of commercial excellence, is also gaining an extraordinary amount of importance, because you see that in other industries. So what's your thought on our industry, sir? How do you think it should shape up going forward, sir? I just thought of closing our conversation.
Very nice. Shailesh, you're absolutely right. The sort of, the sort of impact what this pandemic has had in our lives. Last evening I was talking to someone. I couldn't believe that, we have, managed to work from home for about 18 months, in many cases. And, it's a long time. If somebody has told me in March 2020 that for next 18 months, we'll all be working from home, I think, say, assume that there was no pandemic, then I would have thought the guy has gone crazy, How can we execute this? How we can, this just won't work out. But somehow we have managed, we have coped up, and there have been some sort of losing some colleagues or somebody getting very serious with amongst friends and family. That has been the sad part. But at the same time, there has been a lot of learning from an industry standpoint. If you see, we have also come through this by and large successfully. One is, of course, what do I say, in terms of the financial part, of course, you are a pharmaceutical industry. What hit us was the health crisis. If it doesn't help pharma, who else will benefit? So investors were maybe more kind to pharma companies, because they thought that these are the companies. Health is almost recession free, and that is one aspect. But I'm not talking about that. What I'm talking about is how have we transited through these 18 months, and from what we were before and what we are now in terms of our practices, in terms of our practices, our day-to-day working has got impacted tremendously. So you see the way actually the patients reach out to the doctor. So you would not have thought that somebody can just phone up, do a WhatsApp call, or take an appointment through Practo or whatever, and then be done with that. You're sitting at home and everything is done. So that is something that has come in. But I would again quickly add that if you see the legal disclaimers that are there in a doctor's prescription when you do this sort of a consultation, also means that this consultation has got its own restrictions. It is not good all the time to go digital. Sometimes the doctor may feel, no, I need to see you physically, I need to examine you, so why don't you come up and meet me? So there is a space for physical, but a lot of follow-up visits, regular visits can be managed digitally. Now, when you manage things digitally, the way the doctors write prescription changes. There are drop-down menus, or as opposed to top of the mind recall and writing your brand name, and stuff like that. So it has affected how patients reach doctors, how doctor consult and advise their patients, how medicines are prescribed, and how medicines are bought. So today you have got this surge of online pharmacies and how medicines are purchased, how medicines are distributed. So everywhere it has changed. And so much so that, in a digital world, some companies have enabled digital calling. So then how do you monitor a digital call? What is the role of a manager, the second line manager, etc., etc. Even those things have undergone a change. So suddenly you find that the old metrics, the settled system and the settled way of operating no longer is entirely paying dividends, or that's not the right thing to do today. And this happened pretty much quickly. So now, how it is going to fall in place as we go forward? I think, as you said, Seleji, I think it is going to be phygital or partly, because hybrid is what I see everywhere it's happening. And how do I make sure that in the digital medium I am quite heard and I'm also relevant? See, that's what it is. It's not about sheer noise. Saleji, we were talking about this campaign mania, or this hurry to execute. I can understand, because there is so much of, you are measured more often. There's a quarterly review and all that. So you want to execute something. But, but at the same time, like you actually need to know whether what you're executing is right and whether this is the right thing to do. So similarly, you do your physical meets, you do your digital meets, but then understand your customer where he is looking for a physical meet, where he is doing for a digital meet. It's not just a question of convenience, availability, and time. It is also a question of what type of events you want to do physically, what type of events you want to do digitally, what type of patients you want to do physically, what type of patients you want to see digitally. So once you get deep into his mind and understand all this, you and me will be able to position our products better. Our offering will be more relevant, because relevance is the key. I can do 100 things, but if most of them are not relevant, okay, it will make some impact. But if I do a few things, but they are highly relevant to his practice and adding value, it will make a big difference. So that is what I see the thing evolving out. So, it is still the industry has thrown up something which is more challenging and interesting and exciting for the new set of marketeers out there to, now face up to this challenge and come out successful. We can have new leaders who have understood this game better.
No, it's a good valid point that you mentioned in terms of the pros and the cons of both digital versus the phygital piece. And I think there's not going to be a clear answer. We're still evolving, as we say. Sir, we in the 80s we evolved from product-centric marketing model to then late 90s of CRM model, customer relationship. Then came the patient centricity model of specialty selling. Now, do you think we're moving into the digital transformation model? Do you think it will mature and it will become better for our industry? What's your quick take on that? Do you think it will be here?
Somewhere I studied, or rather I read that the CXOs, or the sort of the digital guys are replacing the marketing people.
Yes. Yes.
But what I feel, it's only time will tell. But what I feel is still digital is a medium. Let's not forget that digital by itself is not a message. Your medium has changed, because everything today, the world runs with a phone, This mobile phone controls everything. So you are able to access the customer, your consumer, very, very easily, very quickly, get his insights. Are we doing justice to that in terms of gathering insights? That's a separate issue. But you are able to access somebody anywhere, anytime, no longer out of office replies. You are there on office 24/7. And with this outsourcing and whatever we are talking, you can sit in the case of Afghanistan and knock out somebody of their job in Times Square or New York. So We are so much connected digitally. But again, digital is a medium. Digital is not a message. So
Correct.
that I think is very, very important to note. So I have to leverage this medium because it has got huge advantages and it is impacting people's lives. It is impacting our customers' lives, the way they behave. It is impacting the patients' lives, the way they seek information and all that. But still, the message what goes through digitally is more important. It's very, very important. So what somebody went, door by door to the doctor's clinic to share some information about the product is now can be done very quickly in a far more larger scale in a short span of time. But then what you put there is going to, because there is going to be a deluge. People are going to get sick. I no longer see many of my messages. There is overkill of information. So somebody is going to get very discerning to say these are the messages I'm going to see. These are the messages I just going to drop looking at the name who has sent it. Now again, it is crowded. And what differentiates is the quality of your message, the relevance of your message.
Relevance, the content.
So
Absolutely.
again and again, you can't run away from the fact you need to understand your customer. You need to read their mind constantly. You need to understand their new challenges, what they are facing in their practice, and then adapt yourself very, very quickly. So as I told you, it's more like a T20 game. You need to adapt. You need to quickly think on your feet. But at the same time, yes, message what you are giving should be relevant and it should add value to the to the doctor and his patient, because you can give wishes on his birthday, anniversary, all that are great, fantastic. But believe me, 100 others are going to do the same thing. And beyond a point, they are also discerning. They understand you're doing all this because you want prescriptions. But when you actually teach them new skill, uh, you know, give them an experience of how to diagnose things from a new perspective with an expert speaking, new techniques, new tools. I think that he is going to remember for a lifetime.
Lifetime. Mr. Vasan, it's been absolutely a pleasure talking to you over the last hour and 20 minutes. And I was looking forward to this conversation because I think coming from you, who is one of the biggest marketing gurus in the industry that the industry has seen, known, and personally I've known you for over, I think, almost 2 decades. It's been a fantastic experience talking to you, sir. Tapping into your, deep knowledge and experience reserves, how you build brands and putting out some strong messages for our marketeers community. In fact, our community is 1,000 strong, and it's only growing by the day. We have brand managers, marketing heads, GPMs, commercial directors, business unit heads, and even VP clusters who regularly log into our channel, both the YouTube and the Spotify channel, listen to the podcast. So it's going through all the digital medium. But as you rightly said, it's the content and it's the relevance, and not just the message which is important. Sir, it's been fantastic. I sincerely thank you that you're a guru for all of us. There is
no, not at all.
as I said, you are an institution of marketing. There is no doubt. All those of our era and also those who have seen you, worked with you, have the highest regards and respect for you, sir. Thank you so much for coming on to our platform. Sincere, honest, thank you. It's great to have you on our show, sir. And before we sign off, any last closing messages for the generation of marketers would only be apt, sir, in the next couple of minutes, although we have run out of time. I request any last closing messages, sir.
Sure. So, okay. First of all, thank you, Salejji. I think you have been very, very liberal with your words, and I don't know truly whether I deserve all of them. Honestly, I'm very humbled. I'm pretty much a little bit embarrassed as well. But I should tell you that, I know you for a long time. Your achievements are no less in the industry. And I'm happy to see you in this role where you're taking it up very passionately to help a lot of budding marketeers in the pharma industry, which is pretty much laudable. And yes, I think what is my final parting word? I would say that there are a lot of bright, young, energetic people out there, and they all want to make an impact. They are committed. So I think with this passion, if they work and work to make an impact, don't chase designations. Like I want to become a general manager, I want to become a vice president. Forget all that. You are being assigned a job. Do that job. Say that I want to be the best in my job, and I want to do it very passionately, very. I want to make an impact. I will make an impact in this job and then move on to my next job. So before I make an impact, I'm not going to shift the Rolling Stone. Yeah, I know that there are so many other things which need to come together, but then don't worry about what is happening to your peers, etc. Take a job, make an impact, and then move on to another job, and ask always, for roles which you have not done before. Maybe a lateral movement into something else, to understand. There are a lot of allied functions. There are some specialized functions like which one may not, like you can't get into R&D even if you want to, if you're from sales marketing. But at the same time, there are a lot of business development types, and there are allied functions. Today we were talking about how people are hesitant to move from marketing to sales. But there is digital marketing that is opening up in many companies as a department, and there is market research, there is big data, as you said, data analytics department is opening up. Try to get that wide exposure and try to make a difference. Bring out the industry is always calling for people who can make a difference, meaningful difference, relevant difference, and then you keep building your career. And then you don't know how 35 years have passed, and you look back and see that you've come a long way, and you enjoy your journey, you're happy, you're contented, and I would say that this is what I would expect from my team to do. Don't get anxious. Everybody has enough space under this sun, and we will have our time to shine. So there is no problem at all. But then try to make a difference in the job what you have got in hand, and that by itself will take you higher. And it is all between you and your job, and nothing else matters. To an extent.
Thank you so much, sir, for those closing remarks. It's a very, very apt and relevant even today. And I think those are the learnings of life, sir. Whether it is now or ever, those are learnings for life: to be passionate, to be committed, to be inquisitive, have filled with learning. Don't be designation focused. Very rightly said, in the rush to grow, you have to learn as well, and you grow. Yeah. Thank you very much, sir, for your time and for spending your evening with us. It's been wonderful having with you. And I look forward to our continued association in the future as well.
Thank you. Thank you so much. It's my pleasure. My pleasure and honor to have been invited. And thanks a lot. And I tell you, intellect test is actually, making the difference, because you know what your positioning is and what you're offering to your esteemed customers. Thank you very much, Shailesh. Wish you all the best.
My pleasure, sir. Have a great day. Thank you so much.